Hi, I'm Dr. TJ Staff, one of the Associate Program Directors for the CU Family Medicine Residency and for the Denver Health Track. Welcome to Lowry Family Health Center, our continuity site. This is our lobby in the clinic. I want you to notice a few things here. The architecture is actually very nice for a federally qualified health center. Having worked for 20 years in FQHCs, this is one of the nicest I've been in. Denver Health has used this architecture for all of their new clinics. We have 10 FQHCs in our system and over 17 school-based health centers. We have a full-service 340B pharmacy. We have an enrollment desk to get people enrolled in Medicaid or on our sliding scale. Of course, check-in, check-out, full dental suite for adults and children, and also a WIC office that's co-located in our building. We also display a world map here in the lobby because our clientele is we see people who speak over 40 different languages here. We're back in the clinical area, and I wanted to take a moment to point out that we practice team-based care here, and we divide into 4 teams we identify as blue and orange and green and red that are our 4 core primary care teams. We have several members who are ancillary members or extended team-based care members that also help us, including addiction counseling and behavioral health. So I'll take you through a tour of our clinical area now. Most of our exam rooms are similar. We have 28 here in the Lowry Family Health Center. So here we have the patient exam table, the computer terminal. We utilize the Epic electronic medical record. The telephone, actually we use a lot of telephonic interpretation, and so we'll have that on speakerphone quite often. And then also just a patient waiting area and curtains that can be used to divide the room up if you have family members. This is one of 2 procedure rooms here. In this room we do colposcopies, vasectomies, non-stress tests for our pregnant patients. Our workspaces out here are cubicles. There's plenty of workspace for everyone. Our team does include a nurse on each team, medical assistants. We have patient navigators here as well. On the patient navigator note, we do have 2 that are for all of our patients and 2 that are grant funded just for our refugee patients. We passed the laboratory already, but this is the center of the clinic where we talk about our daily schedule, who is working in which rooms. We also present our quality improvement data and the metrics that we're following here on what we call our Gemba board. We're very fortunate to have a clinical pharmacologist who also is here that we can consult at any time during the week. And so she and her residents are always very helpful in the course of providing primary care. This is our other treatment room. We also have a non-stress test machine in here. We keep our ultrasound in here, our EKG, our crash cart. But just to have access to this facility is really nice in a big clinic like this. This is what we call our bullpen. These are where residents have desks and where we do our precepting. In normal times, behavioral health also shares the room with us so that there can be a lot of warm handoffs and consultations done right here. As a resident, this is where you spend most of your time during your clinic sessions when you're not seeing patients. When you're doing telehealth visits, we do have private rooms you could use or do them remotely. And we're just beginning to do some video visits as well. We do a lot of presentations on the immigrants and refugees we take care of here, and here's a nice breakdown in terms of the most common languages used by our interpreters and when we're caring for patients. And so we use that updated pie chart all the time. And this is a room that can double as a lunchroom and a large classroom with a room divider. We'll have clinic meetings in here as well as didactics for the whole residency or just individual classes or programs. Lowry is situated on the east side of Denver. It's actually not too far from the other residency clinic and in between the two hospitals. Denver is a bike-friendly city, and so we do have the ability to bike here. We have locker rooms and showers as well. Welcome to Lowry Clinic. We hope you enjoy your interview.